Dr. Gate, if you come this way just a little bit more. Thank you very much.
Okay. First, I'd like to thank everybody for coming out on such short notice. Things are moving very quickly, and decisions have to be made quickly sometimes. So, as you know, last week we had to close our secondary school facilities because a person who had tested positive for COVID-19 entered a building without notifying staff, and is the source of many positive cases that has led to an outbreak. Since that time, we have continued to contact trace and even held a testing clinic at 2 of our facilities. We tested over 1,800 people. Almost 1,000 of those were students. Based on the testing results and contact tracing, we have determined that there are 198 active cases currently in the Amherst County Public School system. All of last year, we had 100 active cases. We have still not received all the results from the Virginia Department of Health, but we assure you that we will be notified by school personnel if you have tested positive or your results were inconclusive. Clearly, we have a major health issue in our community. We have determined we cannot safely operate schools until September 13th. So at this time, I'm announcing that all Amherst County Public Schools will be closed beginning Friday, September 3rd through Friday, September 10th. Students will be able to return to school on Monday, September 13th. We believe that this will be sufficient time to contain the outbreak. So what does this mean? This means that there will be no in-person or virtual instruction. There will be no transportation provided by Amherst County Public Schools. There will be no extracurricular activities, and no meals will be provided. All students and staff should consider that they have experienced some exposure to COVID in the last week of school and to act accordingly. We've been asked numerous times, why don't we do what we did last year with the Amherst Remote Academy? Last year, we were in a state of emergency, which allowed the Virginia Department of Education to waive many requirements. Most significantly, they gave us the flexibility to attend in person for fewer days and for less clock hours. This allowed the school system to direct staff and resources in a way that we could provide remote opportunities for those that chose those opportunities. This year, however, we are not given that flexibility. As a matter of fact, the General Assembly passed a law that requires school districts to offer in-person learning 5 days a week, all day. Because of this law, I need all of our teachers and staff in the building to meet the needs of the expanded number of students in our buildings. We did provide Virtual Virginia as an opportunity for remote learning and opened registration in June. Virtual Virginia closed their registrations in July and will not be available until the second semester. We will provide self-directed instruction opportunities for our students. They will be available on our website, and the activities will be in math and reading. This is not an easy decision, nor one we make lightly, as we understand how important being open is to our community. This is not only the school's responsibility. To remain open, it is the entire community's responsibility. Our students spend more time in the community than they do in the school, so it is imperative that we work together to ensure a safe return for every child every day. We encourage the Amherst community to continue to follow health and safety mitigation practices to ensure a timely reopening of schools. We also want the community to understand how important it is to receive information from one source as it relates to school, and that source needs to be me. It is very difficult to provide clear communication when there are so many assumptions and rumors that are shared through social media. At this time, I would like to ask Dr. Carrie Gately, a health director of the Central Virginia Health District of the Virginia Department of Health, to join us and talk a little bit about what's going on in our community with COVID-19. Dr. Gately.
Thank you, Dr. Arnold. I'd like to start off by just saying amen to what you had to say. I really appreciated those remarks. I believe it was January 17th of this year, In the Central Virginia Health District, we had our highest number of cases reported in one day, and that was 379. Today we reported 378 for September the 2nd. So we are seeing levels of cases per day, the total number of cases that are being reported each day, pretty well at the level that we were seeing at the end of January and the beginning of February this year. And so that number alone says we've got a lot of transmission going on throughout the Central Virginia Health District. COVID is still here, still alive and well. As I've said many times before, we're done with COVID. We're so tired of it. I'm exhausted with it myself. But COVID is not done with us. This is a virus that we're dealing with, and it does what viruses do, and that is infect people, reproduce itself so as to infect other people. As long as you give this virus, particularly the Delta variant, which is very efficient at this, as soon as you give this virus a chance, it will infect and reproduce. What's a chance? Well, if you have a person who is infected, a case, and who is infectious, then being close to that person, especially being close to that person for an extended time, is going to put you at risk. Now, people a lot of times, and I love numbers, Dr. Arnold, and I really like to work with numbers, but sometimes people get hung up on the numbers and they lose the bigger picture. So people will say, well, how far should you stay from a person who is infectious? And the answer is the further the better. The closer you are, the more likely transmission. The further away you are, the less likely transmission. The less time you spend in the presence of an infected person, infectious person, the better. The more time, the worse. The better the ventilation, the less likely that you are going to be infected. The worse the ventilation, the more likely you're going to be infected, so on and so forth. Masks correctly worn certainly can affect but not guarantee a reduction in your risk of infection. All of these factors come into account together. Another factor, of course, is how many ready hosts the virus will find in any particular situation. And that means people who have neither natural immunity or immunity by vaccination. Now, we know in the case of our schools, for example, that there are a number of students who, by age, are not eligible to receive vaccination. And so already you have a handicap in the schools of having a situation of bringing together susceptibles into the classroom setting, into a group setting. If you introduce the virus into that setting, it will take advantage of all those hosts. In the community at large, as Dr. Arnold also mentioned, we have, unfortunately, relatively low vaccination rates. When you're hanging at a vaccination rate of around 50% of your population, and the exact numbers don't matter so much as the big picture, the larger proportion, you still leave roughly half of your population that is not vaccinated and also has not yet been infected and developed natural immunity, which will be ready hosts for the virus. And that's a large number of people. You bring those people together in school, in church, in any setting, a family gathering, any setting that you want to talk about, and there is a risk of transmission, sometimes substantial risk of transmission. This is going to go on until either we achieve a level of vaccination immunity or natural immunity or some combination of the two to deprive SARS-CoV-2 of ready hosts. The cycle to continue must have non-immune hosts who can perpetuate the cycle for SARS-CoV-2. So we're going to have that until we can do something to decisively interrupt that reproduction cycle. I think that's all I'd like to say, other than to encourage everyone to really consider the sources of information that you're using, as Dr. Arnold referred to, particularly with respect to treatment for COVID and with respect to the vaccines and the effectiveness of the vaccines. Once again, in the real world, in the world of biology, there isn't a perfect vaccine, a perfect mask, anything of the sort, and neither is there a completely worthless vaccine or completely worthless mask. Everything is a continuum somewhere between. So be careful to be well informed as you're making your decisions, as you're making your assessments, and as you're balancing risks and benefits of all of these interventions, all these mitigation strategies that we're talking about. Thank you.
So as always, I will provide the community with additional information as it becomes available. I want everyone to know that this is a resilient community, and our staff is made up of some amazing people. They love children. We are going to do everything we can to get our students back in school. At this time, I'd like to take a few questions if you have them.
Just to reiterate.
Hang on one second. Take that. Thank you.
Just to reiterate, just to make sure we're all following.
Okay.
Can you just go over again what the protocol is for closing down schools for everyone, so there will be no instruction
No
for
instruction.
any students?
Right, because with the number at 198 and also understanding that there are many staff members on that, we're going to have sick people, and we're not going to be able to provide equitable resources to all students. And so we're going to put it online in our Canvas, and we're going to make it available if parents want to keep their students engaged. But that will be their choice.
So of course, we're already playing catch up from last year, and how are you going to, in essence, do that, knowing that we've also had that hit to the SOL scores across the state?
Well, our chief academic officer in the back of the room is continuing to work. We are going to use the SOL scores to help us determine where our students are. We also use a type of testing program that tells our teachers specifically where our students are with their math and reading skills, and we will continue to target the specific skill deficits. But I think it's really important to understand, and we've been talking about this for a long time, but the disruption to education that's occurred over the last year and a half is not going to be made up just like that. This will take a long time to make up all of that disruption. But educate kids is what we do, and that's what we're going to do. We're going to keep doing this. We just have to get back in school safely.
Something like this, do you think it could have been prevented?
I believe it could have been prevented. Unfortunately, like I said, we had a person knowingly had been tested positive, came into our buildings, and with the Delta variant, as Dr. Gately mentioned, it is very, very contagious, and it just ran through our schools so fast. We are following mitigation strategies that we used last year. We are closer because we are required to have all of our students back in the building, so we don't have that same ability to spread out. But we do have a mask mandate. We will continue to clean. We have been cleaning. The thing that we don't have control over is when students are sent to school either ill or having tested positive. And if that happens, we're going to run into a situation like this. We have a community that's worked really, really hard, and a staff that has worked really, really hard to get back into school, but it only takes one person. And you can see the result of that.
Will all your buildings be closed to students as well as staff, or will any staff be working?
Students and staff, we are asking our 12-month, our administrators to report because they can isolate, and we can get our work done over Zoom or Google Meet, and we can do some work to make sure that when we return, we can do so appropriately. Okay, if that is all the questions, like I say, we will be back in touch with you as soon as we have additional information to let you know. Thank you for joining, and we'll be with you soon. Thanks.